And of course, I am very excited for this unveiling of the Start Right program. This initiative is very dear to my heart and of course to the Ministry of Health and Wellness. So very excited that we're going to unveil this through the Ministry of Health and Wellness.
And we're going to go one,
three.
two, three.
All right.
Yeah. Thank you so much. And I have to thank the Honourable Dr. Christopher Tufton, my minister in the Ministry of Health and Wellness. And I have to say, you know, he actually pushed this on me and he said, Juliet, I'm going to give you a project that you need to finish. In 2020, he actually laid this in my hands and said I was going to do this baby box project. And I want you to take this over. Of course, the COVID-19 pandemic came. Dr. Endis and I were trying to work on it. Didn't get a chance to really finish it. And as soon as this year started, we said, let's get back on track, and here we are. Dr. Trevor Dixon, founder and CEO of JAHJAH Foundation. Ms. Wendy Hart, of course, so critical in this, president of the AFJ. Ms. Karan Chung, she's not here, but let me tell you something. A few months ago, again, my minister said, look, I'm going to put you in the hands of Ms. Chung, and she just took this off with her team, and I have to congratulate her and her entire team for really making this happen with us. Ms. Adwana Clayton, Director of Training and Education, Butterfly Global Health, Dr. Garfield Clooney in Maternal Fetal Medicine, and of course, Dr. Melody Ennis, who was the lead in this. We put this in her hands to really take over. All the senior medical officers, all the directors in the Ministry of Health and Wellness, and of course, our distinguished guests and members of the media. Again, I am just overwhelmed with joy this morning that this project has really come to light. Ms. Watkins, we know that even during her vacation, we were hammering her to make sure that we were here today with the Start Right program, that we got it off the ground. And so I'm really delighted to unveil and introduce the latest initiative in our maternal health program. This is needed. This is indeed a really monumental day for Jamaica's public health, made through possible with a partnership that we're forged. Maternal care continues, as we know, to be very important in the promotion of good health and well-being. Essential to this is for all women to have access to respectfully and, of course, high-quality maternity care. And so allow me to set a context before we get into some of the more tangible aspects of the morning's launch ceremony. Top of the global health agenda is ending preventable maternal deaths. Minister Tufton spoke about it and where we are. And so we really, especially after COVID-19, we saw how many mothers really passed away from comorbidity of the COVID-19 pandemic. And so we really need to get your numbers down. And so the World Health Organization knows that maternal mortality greatly affects women in low resource setting, with maternal mortality pronounced among women living in rural income surroundings, and we have lots of rural parts in Jamaica. Moreover, it is noted that adolescents are among those who are mostly impacted as they face high risk of complications because of pregnancy. It is therefore essential that all women, especially those most vulnerable, have access to high quality care in pregnancy, during and after childbirth. And as the Ministry of Health and Wellness, we continue to give a keen focus to addressing inequalities in access to maternal and newborn health care services, and identifying and mitigating all causes of maternal mortality, morbidity-related disabilities. Our maternal health program prioritizes care across the continuum, from pre-pregnancy, birth, postnatal, and early childhood through to the first 5 years. Our dedicated efforts include, of course, enhancing universal health coverage for comprehensive reproductive, maternal, and newborn care in order to deliver better outcomes for every pregnant woman and newborn. We note that it is critical that women be able to access emergency obstetrics care, especially when faced with high-risk pregnancies, and it is especially imperative that skilled health professionals, all of you in this room, attend to all births. These are among the ingredients of a robust maternal health program. And so the Start Right, it is on this basis that I'm honored to introduce the Start Right, a maternal and newborn care initiative that aims to foster happy mothers, healthier babies, and of course, what do we get? We get a stronger community, and that is what we're trying to build. Because again, with all the things that's happening, it did not just start just like that. It started from here, and so we have to make sure that we are doing all the right things. Start Right will serve vulnerable mothers as they access care through the public health system. Overall, this initiative is focused on improving pregnancy outcomes for high-risk, low-income pregnant women. Start Right brings before us a tremendous opportunity to improve our maternal health offerings, but even in a broader sense, the family. Ensuring a mother's well-being before, during, and after pregnancy will enable her for better care for herself and her newborn. And so we're giving her the tools to actually do that in the first at least 6 months. This need is quite evident among those who are neither financially, emotionally, nor socially equipped to handle demands brought about during maternity. Consider the mother with limited economic opportunities, or the teen mother, and we know there are lots of them, teen mother who is yet to understand in full the role that lies ahead. These mothers need the support in order to start right. We know all too well that many such mothers often come forward for care late in pregnancy. And so this delay in care, regrettably, can affect mothers and babies' health throughout and after pregnancy. This is why we conceive a community health perspective for this program in order to receive vulnerable mothers into care with the help of our community health aides. And we saw how important those community health aides was during the COVID-19 pandemic. We were really, I thought, the lead in that, when you look at what was happening throughout the world. Provision of prenatal support as well as timely management and treatment can make the difference between life and death for mothers as well as their babies. In addition, the Start Right will provide a range of care supplies for vulnerable mothers and their newborns, and also deliver improved diagnostic service across public health facilities through modern state-of-the-art ultrasound technology. The specialized training for healthcare and specialized training for healthcare providers. The Butterfly handheld ultrasound monitor will receive into the obstetrics, as we heard, units of 8 public health hospitals. The portable device supported by iPad technology will enable early and rapid diagnostic tests, as we've heard before. And so this is really cutting edge for us, as we've seen on the monitor earlier. On the rollout, we'll have 100 of these given to our adolescent mothers, and also of vulnerable mothers, and will also receive the Snuggleness. Again, unfortunately, it's not here, but those will be on island, I believe, soon. This is a portable infant lounger bed for the mothers, as well as essential items, including diapers and skincare and all the things that you see to my right. The program, of course, will later target some over 2,000 mothers, and we hope to actually have that launch sometime in March. And so this morning, again, as I said, this proud partnership today is a representative of the solid association between partnership and public health. This proud collaboration between the Ministry of Health and Wellness and the American Friends of Jamaica, JAHJAH Foundation, will reset the lives of many mothers and their newborns, giving them the right start. I want to commend my deepest thanks to both entities and their leadership, and look forward to greater gains that will come from work over the years. We in the public health continues to recognize the vulnerability of pregnant women and their newborns. Our focus in this area is especially heightened as we seek to strengthen the capacity and resource to optimize accessible, equitable, and high-quality care across childbirth continuum. The pleasure is now mine, as I said, to usher into this program with our project, and of course, we have already unveiled this, And I want to just thank everyone. Again, I want to express my gratitude to Karan Chong of the AFJ, and of course for the strong partnership. Also to you from the JAHJAH Foundation and everyone who actually helped this program for us to be here this morning for this launch. Thank you so much.